State lawmakers are considering a wholesale ban on any requirement for a COVID-19 vaccination. And listening to how Representative Jeff Leach just justified the need for SB 7, I can't help but think of Patrick Henry's famous quote, "Give me liberty or give me death." I wonder if Henry's stance against the redcoats of his time really applies to those in lab coats right now, which is why my word was application. Greg, Houston hospitals were at the center of this fight during the pandemic. What are administrators there saying about this bill?
Look, Rudy, I'm pretty certain they are launching the kitchen sink, that is their considerable resources and lobbying power, behind an ironclad exception for the healthcare sector. Consider the stakes. Imagine trying to attract and retain doctors who might be forced to treat patients in a pandemic while potentially working alongside staff who have opted out of medically advised vaccines. Or how about the resentment that would be generated if some vaccine-opposed healthcare workers remain on the payroll while excluded from the clinical setting, essentially shifting the treatment workload onto others in a crisis. Now, regardless of how you feel about vaccine, that's a recipe for chaos and devastating professional flight out of the state.
Yeah, chaos is a good word too, isn't it? You know, around the tail end of the pandemic, the governor issued an executive order that banned COVID mandates. It has since expired, and because of that, during the regular session, a new state law was passed that bans government agencies from requiring a COVID vaccine. It took effect just last month. Stephen, Texas Democrats have argued applying the ban now to private business without specific exemptions just goes too far. What amendments are you hearing that may come on the floor debate?
Well, we're going to see a lot of amendments and proposals from Democrats on the floor debate when it reaches the floor, likely next week, because in kind of piggybacking off of what Greg said, if you look at certain entities like a hospital where someone's health could be severely impacted, for better or worse, likely worse, if they're in contact with someone who's not vaccinated, that can pose a risk. I mentioned the word control because this is basically, and you pressed Jeff Leach about this, well, if the Republican Party is the party for freedom, then why are you telling private businesses what they can and cannot do? So we're going to see a lot of proposals from Democrats. It's just a matter of will any of them stick?
Yeah, everything seems to be on its head right now. In the hearing, committee members were told the governor's initial anti-COVID mandate executive order generated a little more than 5,000 complaints. About 22 cases are still being reviewed by 5 different local DAs here in Texas. Greg, while those cases are pending, SB 7 comes with a $10,000 fine. The enforcement part sure sounds like the mandate crackdowns here in Austin and Dallas tried during the pandemic. Certainly, you know, is this a fair apple and orange comparison by me?
Apples, oranges, or maybe just moot. Based upon Republican preemption philosophy and legislation, I'm guessing counties and municipalities will have even tougher time imposing localized regulation than in the past. Now, that said, I want to point to the big picture trend here. This is a state which has pretty much banned access to abortion. This is a state widely considered unfriendly for trans folks. This is a state where gun rights have been expanded and not compressed. And this is a state which has officially snuffed out DEI. Add a ban on vaccine mandates, and Texas becomes even more attractive to conservative voting transplants, and significantly less alluring for liberals considering relocation. Is that a coincidence?
Now we got a good conspiracy theory working there. That's pretty good. Now, those opposed to the total vax ban point to the recent upticks in COVID cases. Supporters are quick to point out that medical experts now agree that the vaccine does not completely prevent transmission, but it can ease symptoms. Stephen, have you seen any kind of campaign to regain the trust from the medical establishment trying to gain some traction in North Texas?
I haven't really seen any widespread campaigns. That doesn't mean that they aren't happening, but this is medical, this is something that is evolving. Messaging is important, communication and transparency is important, and so we'll have to see. This kind of has just become so politically motivated in certain terms when it comes to legislation that you can't really look at what's really the point of really supposed to be trying to help people instead of just taking political sides.
All right, real quick, guys. The governor has dug in deep on school choice. Is this the choice debate that he can afford to lose? Greg, quick.
gets them both. He gets them both. That's my prediction.
Stephen?
Eventually happens, but I don't know if it's this session.
All right, well, that's a wrap for this issue for now. You can see this interview and our past interviews by going to our YouTube pages.
And visit our social media sites to continue the conversation.
The special session has a few more weeks. Things will be heating up in the House this week, so remember to let us know what you think the issue is.